assignment was basically to share with you very briefly some of the work that we've been doing at the Children's Bureau over the years in terms of implementation science and all of our work in terms of grants, in terms of informing policy and provision of technical assistance to states and communities. So next slide. Oh no, I'm sorry. So basically, today what I want to talk with you about is a little bit about the Children's Bureau. How many here are familiar already with the Children's Bureau? Okay, several of you are. Okay, so I'll just talk a couple minutes about that, and then our Children's Bureau and implementation science timeline. A little bit about how we're infusing the concept of implementation science into our discretionary and formula grant programs, as well as our technical assistance and capacity building efforts. And then finally, to talk a little bit about the opportunities and challenges presented by this work. So the Children's Bureau partners with federal, state, tribal, and local agencies to improve the overall health and well-being of our nation's children and families. With an annual budget of nearly, well actually just a little over now, $8 billion, the Children's Bureau provides support and guidance to programs that focus on strengthening families and preventing child abuse and neglect. Secondly, if we think about this as a continuum, protecting children when abuse and neglect has actually occurred, and then ensuring that every child and youth in this country has a permanent family or family connection. At the Children's Bureau, we seek to improve outcomes in the following key areas, and this has been the case since about, I think we developed and made a commitment in our mission statement to these key outcomes about 15 years ago. But essentially, all the work that we do revolves around these goals: safety, permanency, and well-being. With safety referring to the preventing and responding to maltreatment of children. Permanency really refers to stabilizing children's living situations and preserving family relationships and connections. And then finally, well-being. Enhancing our families' capacities to meet their children's physical, mental health, and educational needs. So to achieve our goals, we participate in a variety of projects, including providing guidance on federal law, policy, and program regulations. We fund essential services helping states and tribes operate every aspect of their child welfare systems. We really strive to support innovation through competitive, peer-reviewed grants for research and program development. And at the moment, our portfolio includes more than 200 grants. And in response to one of the comments just made by our speakers, we have had in all of our grant announcements for the last many years an evaluation component. So when you look at our different grant reports, what the grantees send in to us, there's a whole annual and semi-annual reporting requirement. You'll see the results of their local rigorous, and we have that word rigorous in there, evaluation components. We offer training and technical assistance to improve child welfare service delivery. In every, I think, program, there's the offering the training, the technical assistance, the financial support, but with that, as federal stewards, we have a responsibility to monitor all that. And so we do monitor child welfare services, really with the goal of helping states and tribes to achieve positive outcomes for children and families. And a big way that we do that for the last several years, as I've mentioned, is the Child and Family Service Reviews. And finally, another activity is that we fund research and we share that research result to help child welfare professionals improve their services. Okay, that's one.
So the Children's Bureau has been thinking about and integrating implementation science in its work for quite some time, starting with child abuse prevention programs back in 2003. The thinking has evolved over time and been a developmental process, and it has become a priority not just for the Children's Bureau, but for our entire agency. But for the Children's Bureau specifically, a key element has been working in partnership with our grantees, local evaluators, and key experts and consultants who have been brought in to help us support our various initiatives. This is just a snapshot of a few of the Children's Bureau programs where principles of implementation science have been used to guide the design of our programs and our work with the funded project. This is not meant to be a comprehensive list, but it does represent a progression over the last decade or so regarding the types of grants we have awarded, and also the increase in expectations for implementing evidence-based and evidence-informed interventions. As you can see here, some of these programs have to do with helping grantees to select and implement evidence-based prevention and treatment interventions. Other discretionary funding has gone to provide technical assistance to grantees to expand their capacity to provide evidence-based interventions more broadly and systemically. Next slide, please.
So on this slide, we're talking about an example of this work, family connections, neglect, prevention, replication, and work. In response to requests from the field to identify effective child abuse prevention programs in the early 2000s, we released a report called Emerging Practices in the Prevention of Child Abuse and Neglect, and that publication date was 2003. The report included a comprehensive literature review and highlighted several programs that were submitted to us at the Children's Bureau through a process that we had devised, which was a national nomination process. And the three categories that programs could nominate themselves for were demonstrated, effective programs, which at that point in time was considered the most reliable and rigorous program, a category that we named reported effective programs, and then thirdly, innovative programs. As a direct follow-on to that report, we got that report published, and also in 2003, then we wrote and released a funding announcement called Replications of Demonstrated Effective Prevention Programs. We really wanted to invest the findings of this report. We get lots of reports, and we hate to have them sit on the shelf, and so we were very pleased to be able to take the report findings and actually turn them into a funding announcement and seed the field with some funding to actually go ahead and carry out some of these, or have applicants tell us that they would like to carry out some of these programs. As it turned out, we did end up funding eight projects, and they all chose to replicate the Family Connections Neglect Prevention Program, which was first started out of the University of Maryland. And Dr. Diane DePamphlis up at Maryland was the creator and lead of that program. Grantees, the 8 awarded grantees were required to do rigorous local evaluations that included process, outcome, and cost components. So this was a pretty new thing for us in terms of the level of rigor and the specificity around what we actually wanted them to evaluate. We saw this as a great opportunity to learn, and we also funded a cross-site evaluation, which was conducted by local contractor James Bell Associates. This really was our first effort to examine fidelity of an implementation, and we also worked in close partnership with the Family Connections model developer, Diane, as I mentioned. And at the time of the grants, the Family Connection program was also still fairly new to replication, and our cross-site evaluation, in retrospect, we found actually helped that program develop their own fidelity measures, and some of those measures, which have been adapted over time, are still being used today. The cross-site evaluation, as I mentioned, also included a detailed cost study, which has also served as a model for many of the cost studies that have been funded in later years by our Children's Bureau as well as other federal agencies. In 2004, Children's Bureau worked with our community-based child abuse prevention program grantees, and who they are lead age. Every state has a CPCAP program that we fund under Title II of CAPTA. And so we worked very closely with our CPCAP lead agency grantees to establish a performance measure to, quote, increase the percentage of total funding that supports evidence-based and evidence-informed child abuse prevention programs and practices. The field was very interested in moving in this direction. We got a lot of support and interest from the lead agencies. And we also work very closely with our technical assistance providers to help the grantees. As again, you know, in 2004, this was all still very new, and particularly with the prevention field. On the other side of the slide, you'll see the discussion tool, which was produced to help the state lead agencies work with their funded programs to facilitate appropriate conversations and ask the right questions when considering implementing evidence-based or evidence-informed programs and practices. And we continue to provide TA to all these years later, which I think is great, on a range of topics, including implementation and building capacity for ongoing evaluation and continuous quality improvement. This slide talks a little bit about a project that we were involved in back in 2008, supporting evidence-based home visiting to prevent child maltreatment. And again, this kind of dovetails nicely with some of the comments that we heard, but this, again, was still relatively new. But in 2008, ACF and CB funds were made available to support a range of activities, not for services, but really to build infrastructure systems that could fully adopt, implement, and sustain high-quality home visitation programs that would have strong fidelity to proven effective models. Moving ahead 2 years, in 2010, our grantees were folded into the larger National Maternal, Infant, and Early Childhood Home Visiting Program sponsored by the HRSA, Health Resources and Services Administration. Those projects were completed in 2012, 17 grantees in 15 states, each with their own local evaluator. Again, technical assistance to the grantees around implementation science principles was provided. For that project, we again funded a cross-site evaluation, which was grounded in implementation science principles. A key contribution was the development of a fidelity framework that could be used to assess fidelity across 5 different evidence-based home visiting models. The project also defined key elements of infrastructure building that related to foundational activities, implementation activities, and sustaining activities. All the reports from all of this work are available on the website, and you can see the website address there. And I would really encourage you, if this is an interest of yours, to go to that website and learn all the details about the projects and the cross-site evaluation.
So this contract supports the Children's Bureau in its efforts to disseminate and promote the use of knowledge regarding effective evidence-based practices in child welfare. The goal is advanced by providing technical assistance to grantees to promote the implementation of rigorous and practical evaluations, strengthening the quality of reports and other deliverables submitted so that evaluations can be readily extracted, synthesized, and disseminated, advising on research and evaluation issues, and creating and disseminating knowledge about rigorous research and evaluation methods to advance the general state of knowledge and child welfare best practices to child welfare researchers and professionals. The contractor, JBA, conducted a qualitative study in 2011 that included document reviews, site visits, and conference calls with 17 Children's Bureau grantees that demonstrated initial evidence of successful program implementation. They held in-depth conversations with grantee staff members and other stakeholders to explore over 100 implementation factors and concepts adapted specifically from the NERN, or the National Implementation Research Network, model and JBA's own implementation research. And you'll hear a little bit about NERN from Allison Metz in the next panel. Next slide, please. So these are the top 5 factors associated with Children's Bureau grantees' successful implementation of evidence-based interventions. Again, 17 grantees, qualitative, but I think it yielded some interesting information. You have to remember, for a kind of top-down, top-down discretionary grant program. So the first is you have to have a committed, dynamic individual or two who believes in the potential of the project to yield positive results. It's important that the leadership role is official and the individual has authority and clout to oversee the project and overcome internal and external barriers. To the second point, JBA found that the most successful grantees made program implementation a collaborative process by involving project partners from the beginning, as well as developing memoranda of understanding to formalize expectations and project goals and responsibilities. To the third point, it's kind of a no-brainer that you need to hire educated and experienced staff, but it involves more than just the direct line staff who are implementing the program. All the other staff, managers, supervisors, who probably provide coaching, case management, clinical evaluation, they all have to be aligned and on board and committed. They also found that personal characteristics of the frontline staff are just as important as experience and knowledge, particularly being non-judgmental, genuine, caring, and being able to connect with those recipients of the program. Finally, successful implementers started building in sustainability at the beginning of their projects, that is early in the grant period, to ensure funding would continue after the federal grant ended. Next slide, please. So this is a little bit about the Child Welfare Implementation Centers. Since 2009, the Children's Bureau supported TA providers. About 15 of them have been using prevention and implementation science concepts to better assess the needs of state, tribal, and territorial child welfare systems and support their efforts to implement evidence-based and evidence-informed policies, programs, and improvement strategies. Since 2010, most of the Children's Bureau's national technical assistance providers have been tracking and coding their service delivery by implementation stage around the NERN model and or by implementation drivers or those factors that either impede or facilitate good implementation to better understand how they're doing and identify areas that need improvement. From 2009 through 2013, the Implementation Center supported 25 implementation-specific projects that were designed to build the capacities of states and tribes to implement change initiatives more effectively. Anecdotally, organizational readiness, the role of leadership, those champions I talked about, intervention development, coaching, and fidelity and performance assessment were among the areas in which providers seem to experience both the greatest challenges and demonstrate the greatest growth. Program evaluators from each of the implementation centers and JBA have been partnering to analyze implementation data collected across the project sites, and findings will be included in a final evaluation report at the end of fiscal year 2015. Next slide, please. So Allison, I know, is going to touch on this a little later, but the Permanency Innovations Initiative, or PI as we call it, is a multi-site demonstration project designed to improve permanency outcomes among children in foster care who face the most serious barriers to permanency, with the goal of decreasing the number of children in long-term foster care and to build the evidence base for innovative interventions and replicable strategies. The project is distinguished by rigorous evaluation, purposeful application of implementation science, and coordinated dissemination of findings to the child welfare field. I'm going to stop there because I'm going to move on because we're a little bit rushed for time. But if you want to find out more information, you can go to the Children's Bureau website and also the website for the Office of Planning, Research, and Evaluation at ACF.
Okay, and this slide, just very briefly to give you another example of how we actually incorporate the concepts of implementation science into one of our grant programs. This slide shows a logic model for the regional partnership grants evaluation framework. And the regional partnership grants were first begun in 2007, and essentially they are grants to communities to help improve services and to develop community networks and partnerships for parents who are involved in substance abuse. And the whole idea is that they are considered prevention grantees to work with these adults to prevent their children from going into foster care. But I think the point of the slide is just to say that we do have a very rigorous local requirement evaluation, as well as recently, within the last year or two, for our second round of grants, have instituted a cross-site evaluation, which is being conducted by Mathematica. Next slide. Over the years, again, we've been taking very deliberate and intentional steps to improve our delivery of technical training and technical assistance, moving really from a reactive, the state would call to say, I need this, and we're really trying to be much more deliberate and intentional and proactive in our technical assistance provision, really looking at underlying systemic issues and barriers to improve child welfare practice and performance, building capacity and leadership at multiple levels, becoming a more coordinated and integrated system, and really devoting greater attention and resources to evaluation.
So, finishing up in these next couple of slides, over the years we've learned that there are many dynamic tensions around implementation that present both opportunities and challenges for our work with grantees. Fidelity and flexibility. We struggle, just as we've seen in the literature across prevention and intervention science, between the need for model adherence or implementation fidelity and flexibility at the local level in order to adapt interventions to real-world context and populations. To the second bullet, the Obama administration is evidence-based, and our agency has certainly done its best to ensure programs and practices we fund and support have evidence behind them, but the evidence base for prevention in child welfare exists, but it's very limited. So we look forward to new interventions as the science emerges and we learn from our demonstration projects. To the third bullet, this is a challenge as well in supporting and learning from local projects and the desire to generalize and scale up these programs across the entire child welfare field. Child welfare is not alone in this dilemma, as I'm sure the prevention scientists can tell you. I must have attended at least 6 different meetings in the last year on scaling up behaviorally focused preventive interventions for children, youth, and families. There's still a lot for us to learn, yet we have pressure, at least our agency and I'm sure the others as well, to expand what seems to work with a few and have less robust evidence. We've been able to evaluate the outcomes and impact of individual programs and efforts. What we grapple with is how to monitor and assess efforts across an entire system to determine population level or system impact. In order to gain more ground on this, investments need to be made in data collection and data systems that are developed to impose the least amount of burden on busy providers and administrators, and yet provide sufficient data to monitor how the system is doing and correct course when needed. Next slide. Testing promising interventions takes time in order to establish their effectiveness on a more broad scale. However, we are constantly being asked to identify best practices to scale up in order to improve performance and report positive results. I'm sure we're not the only ones with this. Taking something to prime time before it has a chance to fully develop can yield poor results and wasted investments. The second point, multiple drivers and factors versus which ones to prioritize. This is a big one for me. In the research literature, there are a plethora of factors identified that either facilitate or impede successful implementation. At this point, however, all of them are important because the research is not yet there to indicate which to prioritize. In addition, there are a limited number of established measures of these various factors that are publicly available, either low cost or no cost. However, the Seattle Implementation Research Consortium, which is a consortium of about 100 leading implementation researchers, is hard at work compiling and rating information on over 400 measures, and we look forward to that information becoming available shortly. Finally, we struggle with meeting the demands for implementation-focused technical assistance. We have been most fortunate in having NERNs support our grantees, but we probably need like 300 other NERNs or other providers like them out there to meet the demand. This kind of technical assistance is resource intensive, and there's just not enough of it out there. Catherine?
So in closing, the Children's Bureau as a federal agency is really committed to our grantees sharing their lessons learned, and we value learning from them, not only what has worked, not only their successes, but we find, and we tell this to our grantees every year when we meet with them, we want to know about what didn't work because we can learn as much from the successes as from the, I won't say failures, but what didn't work. We need to know both sides of the story so that we can share that more broadly. Many of our grantees' local evaluation activities have resulted in numerous conference presentations and some peer-reviewed journal articles on implementation in child welfare, including several special issue journals on each of our grant clusters focused on implementation lessons learned. So this is another vehicle that we use to try and get the word out about not only our work, but what have we learned from our grantees. We are pleased with our progress over the years, but we know there is always room for improvement. And ultimately, I'd say we are finding that successful implementation is about organizational and systems change, and this requires time and resources and also capacity at federal, state, and grantee levels for ongoing monitoring and support. We know the importance of partnerships, and we welcome the opportunity to partner with our grantees and stakeholders. Along with this, we are also committed to using data, research, and implementation knowledge to guide our program planning and support as we work closely and continue to work closely with our grantees. We look forward to continuing this work with implementation science experts and others to help us continue to improve our programs and work towards the safety, permanency, and well-being of all children.